A kind of conversation, just in general, how to be safe. I know we're in quarantine right now, but for those of you who don't know, I've been working with Whitman-Walker Health Clinic. So we try to do lives every week about, safe sex, COVID-19, conversations that people want to hear about. So we're going to get started real soon. Hello, hello, hello. Thanks for joining. We got some information here from Whitman-Walker. So if you guys have any questions, feel free to hit them up. Don't be shy. Let me get me in the frame so y'all can see. How's everybody doing today? Beautiful. You can see that. You can call 202-797-4439. Perfect. Looks good. Hello, 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 kids, children, adults, everybody. Oh no, so sorry to hear. Hi guys, everyone joining in. We're going to get started in a minute or two. Just for those of you coming in, we're talking about I'm working with Whitman-Walker. Hello guys. Hey JJ, Whitman-Walker. Health questions about COVID-19, sexual and health. There's a number down here in my pin that you guys can call. Call Whitman-Walker, 202-797-4439. We're going to be talking today mostly about how to bring up conversations, how to talk to people, how to be aware. So let's get started. Well, my name is Orlando Machuca. My pronouns are he, him. I work with Whitman-Walker Health Clinic as a social media influencer employee. So I've been working with them for a while now, just getting information out to people who are not able to see or find, or just people that are scared to reach out and ask questions. So today we'll be talking about, in general, sexual health. I know you guys are quarantined, but you still want to remember that, some things will be opening up soon, and we want to be cautious about the things that have always been around before COVID-19, which is HIV, STDs, STIs. So let's get my notes ready. So during the past few months, Whitman-Walker Health Community's health department has been expanded its outreach efforts to the social media platform. We cover various topics about HIV, STIs, sexual health practices, access to care, social detriments of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic, which is COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. So for those of you, you see the number down here, you can follow Whitman-Walker on social media, Facebook, Twitter, and Instagram, phone number and email, and go to the website as well. Today we're sharing some notes and tips on basic HIV, starting conversations about sex and condoms and PrEP. First up for HIV, right? So for those of you who don't know, HIV stands for Human Immunodeficiency Virus. It weakens a person's immune system by destroying important cells that fight disease and infection. So no effective cure exists for HIV, but with proper care, HIV can be controlled. Some groups of people in the United States are more likely to get HIV than others because of many factors, including sex partners, their risk behaviors, and where they live. This section will give you basic information on HIV, such as how it's transmitted, how you can prevent it, and how to get tested for HIV. And again, for those of you joining, thank you so much. Don't forget, all the information is down below. So it can be awkward. You're right, it can be awkward. Sometimes to approach a situation with confidence, chances are If you're confident and bring it up without judgment, your partner will be open to the discussion. For those, for all those of you that know, they could be just as worried about the conversation as you. So bring it up. And remember, nearly everyone who is having sex has had a conversation at some point. Um, before you even know, maybe it's good, because we don't want to get in a situation where we're having so much fun and we forget that we do want to be protected. We do want to be safe. And you think that, oh, this person won't love me or won't care if I bring it up. Well, maybe you shouldn't be with that person. So be very upfront. Be like, hey, I know it might lead to this, but this is what I feel. And I want you to know that I'm super, super, super cautious and I like to be careful. So it's helpful when we have conversations about sex. We love sex. We don't want anyone to think sex is bad. Sex is part of life. So be very sure we communicate. All right. So here are some tips that other folks found helpful in having these conversations. So don't wait until the heat of the moment to start talking about HIV or STIs. It's better to talk about it earlier than later. Certainly before you have sex. So this mostly pertains to, yeah, you're talking to someone for a while and we love it and we want to be sexual with them, but most of us already know that, sometimes random sex happens. So if you know that you're having a good time with this person you just met, bring it up. Be like, hey, not that it's going to go this route or anything, but in case it does, I want to make sure you're upfront. I want to be protected. Condoms, make sure you just bring that conversation up. If it's going to be a one night stand, you shouldn't care if they get mad at you or not, because if they don't care about your health, then, maybe it's something you need to step away from, right? So other folks with HIV have suggested that it helps to talk about their status earlier in the relationship rather than later. Disclosing you're HIV positive after you've become close to someone can cause your partner to feel as though you've kept something from them. That's really rough. So, I mean, I can see how it's uncomfortable because you never know, like, are they someone I can trust to tell? And if I do tell them and they don't appreciate it, how do I know they're going to keep my secret? So in general, as a person, it's really hard to know kind of what decision to make in those circumstances. So it's very hard. So, I mean, be careful. Like if you're getting to know someone, get to know them. Try not to be too sexual too soon, because you want to make sure this is someone that you're interested in. And again, it's so rough. It's so rough to know how to feel. So that's why we have people you can always um, call. We have people you can talk to at Whitman-Walker. So please, like they said right here, conversations about sex before having sex can help you and your partner. And you're always make sure that they're, consenting that, okay, you want to protect yourselves. Beautiful. If you're looking for a way to start talking to them, this webpage, watch the videos together, talk about the campaign, use them to start conversations, approaching conversations this way. It doesn't sound like you don't trust them, but rather that you've been reading about it, you've heard about it, we're talking to a friend who brought it up, and because you care, you want to make sure you're both protected, right? That's super important. We should care about people we have sex with, because you never know. You never know what they've been through. They might not know. They might have not been tested. So you want to be super cautious about these situations when we get into them. And don't force it. Find the right time and a place to have a conversation. You can schedule time to have a talk or a spontaneous conversation in settings where you're comfortable. Try scheduling check-ins. Try having like little talkversaries. And the key to healthy relationship is having an open dialogue throughout the relationship. It can be hard to find the right time to bring these things up. But if you schedule conversations about other things, they'll kind of get used to you having these conversations about, oh, this over here, and make sure that protection is also a conversation you want to have with your partner. whether it's long-term or even just sexual. You know, a lot of relationships are sexual, friendships. You know, maybe you're not dating, maybe you're just having fun. So be very cautious about having these conversations in all aspects of your life, because conversations are good. Communication, people. Communication is beautiful, is a beautiful thing, and it reminds you how human we are. We make mistakes, and we're scared. We're all always going to be scared. All right. So let's see. HIV transmission. Consistent and correct use of latex condoms is highly effective in preventing sexual transmission of HIV. The virus itself can cause AIDS. So for those of you that don't know, you cannot get AIDS from someone else. You normally always start with HIV, and not taking care of HIV is what comes AIDS comes from. So if you hear someone say wrong information, oh, you don't want to catch AIDS, that's terribly wrong and super mean. Let's not use those judgment labels, because it's not true. AIDS is not something you get. It's what happens when you don't take care of yourself, if you don't get checked up, if you don't go to the doctor. HIV is manageable, medication. So you know, get to your doctor as soon as possible and find out what's going on in that situation, and how your specific type, it's going to be manageable, how you can manage it. It's very manageable. We've gone a long way from back in the day when, you know, people didn't know what it was, to now, you know, we can manage it. So be very careful about getting tested regularly and staying safe, my guys and girls. All right, let's see. So it's not only HIV also. There's also many STIs out there associated with conditions. So make sure, you know, we always wear condoms. If you're allergic to latex, there's polyurethane condoms that can be an option. So let's see. Consistent and correct use of condoms reduce the risk of many STIs, as they are transmitted by genital fluids. There's chlamydia, gonorrhea, trichomoniasis. Can't even say that one. So can't even say it. So I'm pretty sure you don't want to get that. So be very careful about, you know, safe sex, guys. It's very important. Let's see. Consistent, all right. Correct use of latex condoms may also reduce genital papillomavirus, HPV infection, and HIV-associated diseases, genital warts, cervical cancer, also genital ulcer diseases such as genital herpes, syphilis, and only when infected area or site of potential exposure is protected. So again, it's not just HIV, it's many STIs that are out here. So let's worry about more than just, you know, COVID-19 at the moment. There's so many other things that have been around that are just as dangerous. Thanks for you guys for joining. We're just talking about safe sex and bringing up conversations. And if you think you've been exposed or had exposure to HIV, call the team at 202-797-4439. You can also start PrEP or post-exposure prophylaxis within 72 hours of exposure to prevent HIV transmission. So if you think you've had sex with someone and they tell you like, hey, I think I might be infected, contact your doctor as soon as possible. Contact Whitman-Walker. And again, like if you can get in there within those 72 hours, they can, you know, try to help and set you up for that PrEP to make sure it you can beat the punch, right? So for those of you that don't know what is PrEP, we're going to talk a little bit about PrEP. So pre-exposure prophylaxis is when people at risk for HIV take a daily medicine to lower their chances of getting HIV. Two medications sold under the brand names of Truvada and Descovy are approved for daily use as a PrEP to prevent persons without HIV from getting the virus from sex, injection of drugs. Studies have shown that PrEP is highly effective for preventing HIV if used as prescribed. PrEP is much less effective when it's not taken consistently. So be very careful that if you start PrEP, you need to take it every day. Don't skip it. Don't miss it. And it doesn't mean just because you take PrEP, you can be not careful. You still want to be careful. because again, PrEP reduces the risk of HIV, but there's still other STIs, as we talked about earlier. So be very careful in those situations. You always want to talk about safe sex, period. Why take PrEP? For those at risk for HIV, daily PrEP is highly effective for preventing HIV from sex or injections, drugs use. PrEP is much less effective when not taken consistently. We talked about that. Is PrEP a vaccine? No. PrEP does not work the same way as a vaccine. A vaccine teaches your body to fight off infection for several years. For PrEP, you take a pill every day by mouth. If you take PrEP daily, the presence of the medicine in your bloodstream can often stop HIV from taking hold and spreading in your body. If you do not take PrEP every day, there may be enough medicine in your bloodstream to block the virus. All right? So again, very important. If you're going to commit to taking PrEP, take your medicine every day. And it's just like any other medicine. You go to the doctor for some medicine and you try to take it every day. If you miss one, try to get back on track. But it's very important to be careful, because if you slack, then guess what? It's very easy for it not to work as much as it's going to work, right? Like they say here, PrEP is at least 92% effective in preventing HIV. That is transmitted through sex when taken as directed. It's a great option for all genders and does not affect hormone replacement therapy. Very good information. Thanks, Whitman-Walker. All right, so now we're going to talk a little bit about HIV stigma. HIV stigma is a negative attitude and beliefs about people who are living with HIV. It's the prejudice that comes with labeling an individual as a part of a group that is believed to be socially unacceptable. So you guys know, just like anything anything that people don't understand is bound to have a stigma. So here's a few examples. Believing that only certain groups of people can get HIV. That's not true. Like, it's very common. You never know who has it. You can't tell who has it. So let's not assume and start making assumptions that we're going to be like, oh, this person has, this person doesn't look like they have it. Like, don't do that. Just like you don't like people judging you in other situations or labeling you in other situations, we want to make sure, don't put that on that person. No one wants to be infected. So making moral judgments about people who take steps to prevent HIV transmission. Yeah, so if someone tells you they're on PrEP, or they only do this certain way, don't make fun of them. Like, they're trying to prevent, and they're trying to be healthy, and they're trying to be more comfortable in their way to be aware and to prevent. So feeling that people deserve to get HIV because of their choices. And this goes back to what we were talking about earlier. Let's not sex shame. Sex is great. We all love sex. Like, if sex wasn't around, we wouldn't be born, people. So let's not slut shame, sex shame. Sex. Some people love sex, so let them love sex. So as long as you're, conscious and you're protecting yourself, sex is great. I mean, we're not going to tell people not to have sex. That's not going to happen. So be sure just to be super mindful of having a conversation. If you're newly diagnosed with HIV and wanting to start treatment, you can also call Whitman-Walker at 202-797-4437. So mostly today, that was more of the facts I gave you, but really just talking about, for those of you who joined in a little bit late, I really wanted to talk about how do we have this conversation with people. Like, I know a lot of us are in relationships and we don't have sex right away. Great. Not everyone is like that. So for those of you, I'm sure you have more conversations in these situations where you're dating someone and you're getting to know them. And that's great. But try to bring up the conversation. Try to say, hey, I'm going to maybe bring up a situation where I'm like, hey, I'm going to go get tested. Maybe, you come get tested with me. That'd be great. Like, imagine like how nice that would be to get tested together and before you have sex. And if that's not your thing, great. But always bring up the conversation. Never go into a situation where you're expecting sex and you're not prepared. Don't blame the other person. We can't blame another person that's not prepared and we're not prepared either. So be prepared. Be in a situation where if you know you're going to go out, have your condoms. You know, ladies, have your women condoms. You know, why always blame it on your sex partner? We need to take care of ourselves. No one is number one but us. We are number one, so we take care of our own. So also we spoke about just getting comfortable having this conversation. If I meet someone today and I'm like, hey, what's up? It might lead this way, you know. You're cool with safe sex? Good, I'm cool with safe sex. You know, don't wait till last minute where he's like, oh, no, no, I don't want to. No, it doesn't work like that, because right there you say no. And you can still say no. I don't care how far you've gotten. Don't be scared to say no. Don't feel pressured to having sex because you already got to this point. So don't. And don't forget, hopefully once, you know, COVID-19 is over, we'll be having our mobile test, is a truck that goes out and does testing. So we'll see how that runs. So be very careful. And for now, if you have an appointment, don't forget, you want to call into Whitman-Walker first. You don't want to just walk in. Give them a call. The number's down here. Set up an appointment, because we want to be careful, especially with COVID-19. A couple little facts we've talked about on our lives is COVID-19 is a scary thing, right? So the safest sex you can have right now is with yourself. Masturbation, toys, go at it. You know, just wash your toys when you're done. More things. If you're living with someone you're dating, great. You know, have sex. If you already quarantined together and you can trust each other, great. No problems. It's very easy to be in temptation, guys. I know temptation is crazy nowadays, but hang in there. If you know that someone's been quarantined and you've been quarantined, yes, I mean, I wouldn't recommend, but if you need to, go quarantine with someone. Find yourself a quarantine boo. That's always a nice plus. And if you see any symptoms of sickness, flu, or any of those things they've been talking about related to COVID-19, you know, do not have sex, because we're not sure exactly all the details of COVID-19 yet. But as any of these STIs or HIV that we've talked to, it's hard to make a judgment call right now. So if you're going to have sex, I mean, you're going to have sex. No one's going to stop you. But at least you can be safe. You can be safe. And please stay safe, because at the moment we don't know what's going on with this situation, and we just want to be comfortable. You know, so especially now, I feel like everybody has little virtual buddies. We're talking to someone online. We're getting to know somebody online. We have time to meet people online. So this is the best time to have these conversations. Be like, oh, if we ever do get out of these quarantine, you better have safe sex, because sex and COVID-19 are no joke, people. We don't want to get sick. We don't want to get our loved ones sick. And yeah, it's all about practicing harm reduction. So be super cautious, be super aware. This is the time you guys have all this time at home. So do some research. Go on, go on a trusted website, go to Whitman-Walker. There's links there. Email them. If there's specific questions we didn't talk about, guess what? Email Whitman-Walker and we can get you on the right path to getting correct information. Don't trust all the information you see online, because you know how that is. So be very careful. Do we have any questions in here? Let's see. How else is everybody spending their quarantine? Supposedly we're opening up phase 1 soon. We'll see how that goes. I see a lot of hellos. Hellos. Yeah, this pandemic is crazy. So yeah, if you have any questions, ask here. If not, don't forget to follow Whitman-Walker. They have social media. They have Instagram, Facebook, Twitter. You can go down here in my little pin section and see the number. Netflix in quarantine, correct. Netflix, there's a lot of Netflix, but please don't look at movies to get sex tips. Please don't. So make sure you guys get a resource that is trusted. Stay safe, talk about safe sex, be very careful. I'm sure that, we're going to be opening up soon and people are going to be running to go whoever they can find and have sex. And great, go have sex. Be sex positive. Don't judge anyone because they want to be sex positive. But be very, 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 very cautious. Be very cautious. Protection, condoms. If you don't have protection, it can wait. Your life is a lot more important than a quick, unprotected experience just because you missed it so much. Hey guys, good to see everyone in here. But yeah, if you have any questions, you see Whitman-Walker, all the information. Follow them on Whitman-Walker, Real Talk DC, and The Corner DC. So if anyone has any questions, I'll stay on for a couple minutes. But if not, we appreciate you guys listening. And don't forget to follow Whitman-Walker. We try to have lives as much as we can now that we're in this situation where everything's going virtual. So I'll be posting it on my page. Even if I'm not coming on, you'll see what we're talking about, who's going to be talking. So make sure you reach out, follow them, Twitter, Instagram, Facebook, call them if you have any questions that I missed out on. Thank you, followers. We love you so much.